Women's multivitamin is a medication that contains a combination of vitamins, which are essential for the body. It helps treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. These vitamins are important for maintaining good health and are essential building blocks for the body. The daily dosage and optimal timing for taking this medication will depend on individual needs and should be discussed with a healthcare professional. Be sure to chew this medication thoroughly and swallow it, usually once a day as directed. It's important to follow all the instructions on the product package, or as directed by your doctor. Don't take more than the recommended dosage, and if you have any questions, make sure to ask your doctor or pharmacist. Taking this medication regularly will help you get the most benefit from it. To help you remember, try taking it at the same time each day. It's common to experience constipation, diarrhea, or an upset stomach when taking women's multivitamins. These effects are usually temporary and may go away as your body gets used to the medication. If you experience these side effects for a prolonged period or they worsen, it's important to inform your doctor or pharmacist. If your doctor has prescribed this medication for you, it means they have determined that the benefits outweigh the potential side effects. Most people who take this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects that are not listed here, it's important to contact your doctor or pharmacist for guidance. In the US, you can call your doctor for medical advice about side effects, and report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, and report any side effects to Health Canada at 1-866-234-2345. Now, let's talk about the uses of women's multivitamins. Women's multivitamins are specifically designed to meet the nutritional needs of women. They often contain higher amounts of nutrients like iron, calcium, and folic acid, which are important for women's health. It's important to note that if your multivitamin contains iron, it's crucial to keep it out of reach of children. Accidental overdose of iron-containing products can be very dangerous for young children. If an overdose does occur, it's important to seek medical help immediately or call a poison control center. When it comes to taking women's multivitamins, it's best to follow the recommended dosage on the packaging. Typically, it's recommended to take 1 multivitamin per day with a meal. This can help with absorption of the nutrients and can also help prevent any potential stomach upset. In terms of timing, there isn't a specific best time to take a women's multivitamin. Some people prefer to take it in the morning with breakfast, while others find it easier to remember to take it at night before bed. Ultimately, the most important thing is to take it consistently every day to ensure you're getting the essential nutrients your body needs. Before starting a women's multivitamin, it's important to talk to your doctor or pharmacist if you have any allergies to the ingredients. This multivitamin may also contain inactive ingredients that could cause allergic reactions or other problems, so it's best to discuss this with your pharmacist. Additionally, it's important to inform your doctor or pharmacist about your medical history, especially if you have a history of alcohol abuse, liver problems, or stomach/intestinal issues like ulcers or colitis. If your multivitamin contains folic acid, be sure to let your doctor or pharmacist know if you have a vitamin B12 deficiency before taking it. Folic acid can affect certain lab tests for vitamin B12 deficiency without treating the anemia. Untreated vitamin B12 deficiency can lead to serious nerve problems, so it's essential to consult with your healthcare provider. Some women's multivitamins may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it's important to speak with your doctor or pharmacist about using the multivitamin safely. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's crucial to discuss with your doctor before using this medication, as it may pass into breast milk and could affect the baby. It's important to be aware of potential drug interactions when taking a women's multivitamin. If your multivitamin contains iron, you should avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. It's best to consult your doctor or pharmacist to determine the optimal timing for taking your multivitamin in relation to your other medications. Additionally, if your multivitamin contains folic acid, it's important to inform your doctor or pharmacist if you are taking certain anti-seizure drugs, as they may interact with the folic acid in the multivitamin. Lastly, it's important to be aware that this medication may interfere with certain lab tests, potentially causing false results. Be sure to inform lab personnel and all your doctors that you are taking this multivitamin. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center for assistance. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Be sure to attend all scheduled medical and laboratory appointments. It's important to note that women's multivitamin is not a replacement for a balanced diet. It's always best to obtain your vitamins from nutritious foods. Be sure to maintain a well-balanced diet and adhere to any dietary recommendations provided by your healthcare provider. If you forget to take your women's multivitamin on schedule, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Don't take a double dose to make up for it. It's important to store women's multivitamins at room temperature, away from light and moisture, and not in the bathroom. Keep them out of reach of children and pets. When it's expired or you no longer need it, make sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.